We're going to look at the wrist today. We're going to look at active, passive and resisted tests of the wrist. Jen, are you okay for me to look at your wrist with you today?
Yeah.
Okay. So first of all, just ask Jen to take a forward. We've already covered the inferior and superior radial ulnar joints, so we're really focusing on the wrist joint here. Okay, the first thing I want you to do, Jen, is active extension. Is just bring your hand up as far as you can. Is that okay?
Yeah.
Okay, and now we're going to get Jen to actively flex all the way down. Brilliant. Is that okay?
Yeah.
Okay, now we're going to look at wrist ulnar deviation. That's lovely. And radial deviation is the opposite way, so keeping the forearm in line and moving. That's great. Well done. So those are the active movements of the wrist. We're now going on to passive movements of the wrist. So again, if you can take your hand up into extension, your wrist into extension. I'm just going to support Jen a little bit there. She's not on the table. And I'm going to apply an overpressure on the metacarpals. Okay, and down. And Jen, again, I'm just going to support you here so you're not on the sharp table. All right, I want you to push down for me as far as you can, and then I'm just going to hold again the metacarpals there and apply some overpressure. Okay, so again, apply some overpressure. Look at the patient. That always gives you an indication of whether they're in pain or not. Okay, again, we're going to look at ulnar deviation. So can you bring across? Again, metacarpals, and you're just going to apply a little bit of overpressure there. Okay, and then the other way. So radial deviation and coming across metacarpal, support the wrist and overpress. Okay, that was radial ulnar passive deviation, and we're going to look at resisted tests now. So again, Jen, I'm going to support you a little bit so you're not pressing on the table. Can you just extend your wrist as far as you can? I want you to hold it there, don't let me push it down. Okay, and relax. Again, make sure you're over the metacarpals there. And push down for me as hard as you can. Alright. And pull down. And, okay, and there. You can also do it in midline there. Okay, does that feel alright? So make sure you're underneath the heads of metacarpals. You're supporting the radius and ulnar. And you get Jen to push down. You can do it in that position, or you can bring it towards end range and you can try and pull up. Okay? Right then. So resisted ulnar deviation, supporting radius and ulnar, coming here to the 5th metacarpal and just getting Jen to push against you there and relax. Again, coming in here, you can swap hands. Again, against the head of the first, there we go, second metacarpal, and get Jen to push against you there. Okay. Thanks very much, Jen. So that was active, passive and resisted tests of the wrist joint. Thank you very much.